Today on Investigate TV Plus, women face a growing healthcare crisis, increasing the risk for expectant mothers and their unborn babies. I'm Tisha Powell.
And I'm Lee Zurich. We examine the factors contributing to maternal health deserts and how states are working to deliver solutions. Plus, millions of Americans in need of a healthcare lifeline.
Why do you not meet the qualifications for Medicaid?
I make a little more than the maximum, and I make too less to invest in my own plan.
We share the story of a man's struggles in the Medicaid coverage gap and why some states refuse to expand this program.
And a photographer captures moments in nature.
When I look through my lens, I'm picturing it, okay, this is my shot.
And develops them into vibrant memories.
It's just so beautiful. It's like you're living in a postcard or something.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. Reliable and high-quality maternity care is a critical need for all women, but that care is being threatened, putting mothers and babies at risk as hospitals nationwide close their labor and delivery units in droves.
The March of Dimes says longer travel distances to access care can increase the risk of maternal morbidity, heighten prenatal stress, and result in adverse infant outcomes, especially in emergency situations. The organization also found that in 2022, there were more than 2 million women living in maternity care deserts, shown here on the map in red. These counties all lack obstetric care and providers. Experts say financial hardship, staffing issues, and the decreasing birth rate are causing the widespread closures.
Reporter Heather Graff takes us to a community where a recent closure motivated a family to go the distance for care.
I think it's one of the biggest things that you can go through in life.
Alicia Alderson is a mom of 3, and she knows firsthand how big a deal it is to have a child.
It's life-changing, it's scary, it's dangerous, it's overwhelming and beautiful, but it can come with so many possibilities for things to go wrong.
At 45 years old, doctors warned Alicia about possible complications with the birth of her youngest daughter, Ava, born in September 2023. But no one warned her about this.
I think it was the day after I decided to take an early maternity leave that I found out that the labor and delivery unit would be closing.
Just months before her due date, Alicia learned the maternity ward in Baker City, Oregon, where she was set to deliver, was shuttering. And the closest labor and delivery unit for her now would be 45 miles through a mountain pass.
I imagine that was a pretty stressful time.
Yeah, absolutely.
Alicia had to make a quick decision. Where would she give birth?
Trying to get through a pregnancy at this age isn't easy on its own. Then just on top of that, having to try to figure out where to deliver and what the safest choice is going to be for the baby and for the family is overwhelming.
The Aldersons chose to cross state lines to Idaho, where they could stay with family and access a hospital nearby.
I'd always given birth around 37 weeks. So we wanted to be somewhere where we felt safe, where we knew we could get to a hospital quickly.
It's a challenge many across the country are facing, because while rural hospitals provide health care access to more than 60 million people, a recent report from the Center for Healthcare Quality and Payment Reform found that fewer than half still offer labor and delivery care. Over the last decade, more than 200 stopped delivering babies, and hundreds more are at risk.
Trying to meet that challenge of recruiting and retaining workforce, providing all the equipment that you need in areas of declining volumes, it becomes sort of a perfect storm of presenting a challenge to access.
Dr. Chris DiRienzo is chief physician with the American Hospital Association and says financial hardship from low reimbursement rates is also taking its toll on these facilities.
That Medicaid covers just under 50% of deliveries in this country, and it rarely provides the resources even needed to cover cost of serving its population.
The Centers for Medicare and Medicaid Services declined to speak on camera, saying in a statement, while states can establish their own payment rates, states are required to ensure that Medicaid payment rates are efficient, economic, and sufficient to enlist enough providers so that care and services are available under the state plan. However, in a 2020 study, the nonprofit Healthcare Cost Institute compared Medicaid payments to employer-sponsored insurance payments and found, on average, Medicaid paid more than $8,000 less.
This all truly comes down to finances and where we decide we want to distribute our medical dollars.
Healthcare providers say they're concerned about how funding gaps are impacting those most in need.
Historically, moms and babies haven't ranked, quite frankly, terribly high on the list.
Outside Nashville, Dr. Eric Scott Palmer practiced in a hospital that recently closed its maternity ward. And he says cutting access can have devastating consequences.
People can't make their appointments. Care falls through the cracks. Preventable things are missed.
As a neonatologist, he says every second counts.
I don't get 45 minutes to get called and come in to take care of that baby, or an hour or 2 hours. I've got 5 minutes. I've got 3 minutes. And if you don't intervene in that quick period of time, that baby is going to suffer for it.
So with communities grappling with how to address this growing crisis, some states are trying to find solutions.
What I see at the state level are the kinds of more rapid cycle innovation changes that are going to be needed to solve for each local population.
In Connecticut, Governor Ned Lamont recently signed legislation licensing freestanding birth centers to operate as an alternative for women with low-risk pregnancies.
When you want to start a family in this state, we're going to do everything we can to help support you.
And in Iowa, lawmakers approved a family medicine obstetrical fellowship program, allocating more than $500,000 to maternal health services in rural and underserved communities.
What gives me hope is our healthcare system is always capable of innovating and finding new and creative ways to serve our communities.
No matter how you look at it, it's a good investment into our society.
Despite everything her family endured, Alicia Alderson welcomed a healthy daughter into the world.
Hi.
But she says the impacts from those uncertain months will stay with her forever.
I don't think it really hit me until we got home. We walked through the door, then I just started bawling. I just couldn't believe that we were here. The baby was safe. It had been such a huge life-changing ordeal.
And Alicia doesn't wish her experience on any mother, adding, the time to act is now.
Because if we don't take care of our children and take care of our families and provide those services that they need, we won't have anything.
According to the March of Dimes' recent report, in 2020, nearly 1,000 women nationwide died of causes related to pregnancy. That's a 14% increase from the year prior and a 31% increase from 2018. With more than 3.5 million births in the U.S. annually, experts say the need to address maternity care deserts has never been more urgent.
We explore another healthcare crisis, this time for people kicked off Medicaid but don't make enough money to buy their own health insurance.
Be a blessing, not only just to myself, but others in the state also.
Up next, we examine why some states refuse to resuscitate this pandemic-era benefit and share how one man caught in the Medicaid coverage gap is now struggling to pay his bills. Later,
for many seniors, it takes one fall to start a downward spiral.
Falls are a growing public health concern as the U.S. population ages. We break down the simple safety measures you can take at home to prevent a serious injury.
During the height of COVID, the federal government instituted a health insurance safety net that allowed Americans to stay on Medicaid even if they no longer qualified. Those protections expired in 2023.
In states that have expanded Medicaid coverage, you can qualify if your household income is below 133% of the federal poverty level. For an individual, that's just over $15,000, and for a household of 3, it's just under $26,000. The amounts are slightly higher in Alaska and Hawaii.
But in states that never expanded Medicaid, about 2 million people have been in limbo for years, not able to qualify for assistance, but also unable to pay for health insurance.
Reporter Peter Zampa goes to Birmingham, Alabama to hear one man struggles in the Medicaid coverage gap.
And he reached out and tried to cut my jugular vein. Had I not went to the hospital that night from someone trying to kill me, they wouldn't have discovered and detected that my aortic valve was tearing up.
Kenneth King says his neighbor stabbed him 3 times, indirectly saving his life. Kenneth didn't know about his heart condition. A temporary and seasonal worker, he isn't offered insurance by his employer. For him, medical care is a luxury.
Have you ever had health insurance?
No, I have not.
Why do you not meet the qualifications for Medicaid?
I make a little more than the maximum, and I make too less to invest in my own plan, I guess.
Today, after his emergency heart surgery, Kenneth is 6 figures in medical debt.
What impact would Medicaid coverage have on you?
I feel more confident in the fact of knowing that I can live a healthier life. I feel more confident going and getting these examinations done and be a blessing, not only just to myself, but others in the state also.
Alabama is one of 10 states without expanded Medicaid coverage. In Alabama alone, 300,000 people are reportedly stuck in the coverage gap. But the end of pandemic-era protections is increasing the number of uninsured in the state by an estimated 60,000 people.
We need to make sure that people have a truthful and factual understanding of what's at stake when we don't expand Medicaid.
Jennifer Harris is the senior health policy advocate at Alabama Arise. It's an organization helping lower-income residents. She helps Alabamians in the insurance abyss navigate their options.
What budgetary concerns are at play for those states resistant to expanding Medicaid?
A lot of times you hear about the cost of expanding Medicaid. One of the things that we see that has played out in 40 other states is that it has not been cost deterrent. In fact, it has been more so cost effective. There is more money there. Again, it's generating money not just in healthcare, but also in productivity.
What is the cost of people not having insurance?
We lose workers. We don't have healthy families. We lose the ability to look at ways to be healthier because we're just trying to stay afloat.
Kenneth wants to improve. He wants to pay off his debts, buy a house, and eventually donate to charities. But until there's coverage that fits his situation, all of that will have to wait.
I would like to be in a position where I can work my family off of social services and leave a legacy for my children.
Alabama Governor Kay Ivey has cited cost as her main reason for not expanding Medicaid in her state. In Alabama, Medicaid mainly covers children, the elderly, and disabled.
More than 3 decades after the death of her mother left her feeling empty, a woman is inspired to fill the void with nature and photography.
I absolutely love the whole process. I just really love it up here.
Still to come, we share the focus of her message.
But first, from slips to trips, falls are a major cause of injury in older adults. We explore simple changes and home safety tips to reduce your risk. Falls are common and costly and a growing public health concern, particularly among the aging population. Every second of every day, an older adult suffers a fall in the U.S., and the Centers for Disease Control says many older adults have a fear of falling because it can lead to a significant injury, disability, or sometimes death.
We give you insight into the programs helping older adults live safely and independently in their own home. Don Johnson knows the pain of a fall.
I fell in October a year ago and destroyed this shoulder. There's 4 tendons hold it together. 3 of them are torn and 1's gone.
On top of that, Don has multiple sclerosis and he's lost his sight. His wife Linda is a stroke survivor and, like her husband, is in danger of falling.
Especially when you're in a position where I can't do anything to help them. You're helpless.
The Johnsons are among 1 in 4 older adults the CDC says has reported some type of mobility problem. And each year, millions of those older adults fall, with 20% of those falls causing serious injury.
For many seniors, it takes one fall to start a downward spiral.
Cindy Felice is the chairman of the Manatee County Falls Prevention Coalition in Florida. She says for senior citizens, a fall can compound underlying medical issues.
They may have been going along just fine, managing all their comorbidities and their issues, and then one fall can kind of tip the scale.
The National Institutes of Health echoes Cindy, saying in older people, the quality of life may deteriorate significantly after a fall because there may be fear of a repeat fall.
We know that once somebody has one fall, this greatly impacts their balance confidence, which could lead to decreased activity.
Timothy Bissonette is a physical therapist.
Walk to that red dot, turn around and come back and sit down.
He says preventing a fall in the first place is crucial.
Regular involvement in exercise, strength training, balance training, staying active lifestyle, active in the community.
You can grab that to pull yourself up, steady yourself here.
Back in Ohio, Akron firefighter Mike Fuller spends his day going room by room looking for fall hazards inside the Johnsons' home and making small improvements like installing free grab bars around the stairs and showers. It's all part of the Akron Fire Department's REACH program to help seniors who have fallen and called 911 for help.
I think the more people that have these devices in place, the less time they're going to fall, the less time they're going to call 911.
It's also allowing people like the Johnsons to stay in their homes.
So when I came to ask him how much is this going to cost, and he says, well, how about a thank you and a smile. So, big smile, maybe some tears, but thank you.
The CDC says it's important to remember that falls are not a normal part of aging. To prevent falls, the agency suggests that you talk to your healthcare provider about risk and prevention. Remove clutter from around the house. Also, exercise is another key to preventing falls because it can improve your strength, balance, and endurance. And make sure to get your eyes and feet checked once a year. Poor vision and improper footwear can increase your chances of falling.
Researchers at UC Health in Colorado found another sense can contribute to fall risk. The study shows people who had trouble hearing cut their risk of a fall by as much as 50% by wearing hearing aids. That's when compared to those who didn't wear hearing aids. While more studies need to be done, researchers say it could be connected to balance and the inner ear.
Their brains are using so much cognitive power or resources to be able to understand, to hear, that those resources are redirected to that as opposed to being able to use it to navigate their environment.
Besides a decrease in falls, hearing others increases older adults' chances of staying engaged and socializing, and there is less chance of isolation and depression.
The 49th state created the framework for her passion.
Alaska grabs your soul and doesn't let go.
Up next, we see through her lens the moments that inspired her to create memories.
Conservationist John Muir once said, "To the lover of wilderness, Alaska is one of the most wonderful countries in the world." That wilderness is what inspired Janelle Fox to begin a journey of photography.
Reporter Dave Allgood shares the brilliant images Janelle has captured with her camera.
The quiet of fall in Palmer, Alaska, and a stroll through her farm.
It's just so beautiful. It's like you're living in a postcard or something.
This is her world, and the visuals are the volume she captures with one click. Pixels that form a moment in a square that is frozen in time to be shared.
I absolutely love the whole process. I just really love it up here.
Albert Einstein said, "Look deep into nature, and then you will understand everything better."
Like things grab my eye more. Like when I look through my lens, I'm picturing it, you know, okay, this is my shot.
An A-frame at the base of a mountain range, the reflection of a float plane, a yellow splash of sun.
I just love it. Like, I don't take anything for granted.
For Janelle Fox, time is a click and a look at what the world has allowed her to frame, to capture.
A lot of people comment on how my photography brings them memories of when they were here.
It is the moment that she looks, lifts, and studies through the lens that these images are born.
The fall is just, it's my favorite. I mean, of course I love winter, I live here, but...
Change, colors, and memories. You see, this former nurse turned photographer has been on the planet for almost 32 years without her mother.
My mom passed away when I was 17.
And maybe these moments, this lone bird, this lofty expanse, is the hole in a heart that is trying to capture the meaning of it all, and why emotional pain is a picture, a hint of a past we cannot change.
But I mean, and obviously it still hits me hard, but she had brain cancer, so.
A wolf runs in a field chased by a raven at the base of Hatcher Pass. Nature is constant. The sun will set, the moon will rise, the photographer presses on.
I absolutely love this gorgeous town that has been my home for over 3 years now. Alaska grabs your soul and doesn't let go.
Knowing that sometimes when the road ends, the journey is just beginning. Seeing the beauty.
That's where I've just always been a really positive person. I don't know, because it's like being happy is just so much easier than...
I have never been to Alaska, but Janelle's pictures inspire me to plan a trip and get out there.
I've been, it's beautiful, and those pictures make me want to go back again. Just incredible scenery there. By the way, if you want to know how good the views are at Janelle's ranch, she told Dave that in the early 80s, director George Lucas was in Palmer scouting movie locations and offered her husband's grandmother $1 million for the land they live on now. They obviously turned down that deal.
Yeah.
That's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm T. Chappelle. Thanks for watching. Next time on Investigate TV Plus, a fine line between duty and danger.
The real important question in all of this is it worth it? Is it worth endangering that person who you're pursuing, the police officer who's pursuing them, and that third party?
An in-depth report on the deadly consequences of police pursuits and the push for policy change.